On the Medical Watch tonight, who gets an organ donation?
WGN medical reporter Dina Baer gets to the heart of the matter.
With precious few organs to go around, there are objective measures doctors use to determine if a patient is a candidate for transplant. Are they fit enough for surgery? Are they smokers? Other considerations are not as easy to measure. Is the recipient able to comply with the strict regimen that comes with a new organ? For patients caught in the struggle, a local doctor steps in to help break down barriers and bring patients steps closer to the life-saving surgery. It's been a slow go for Vanessa Brown. A bad knee is keeping her down. The 64-year-old says her lack of mobility was a strike against her at an urban transplant center where doctors took her off the wait list for a kidney.
Transplant team didn't want to do the kidney transplant until I had a knee replacement. The orthopedic surgeons didn't want to do the knee replacement until I had a kidney transplant, because of course you heal better when you can move and so on, you know.
She was stuck. Dr. Danae Simpson offered a solution.
She said, well, let's see if we can't get you walking on your own again, you know. And that's why I'm taking the therapy now. And, you know, that was just so marvelous that she thought of that.
The desire to help patients like Vanessa grew from watching so many others turned away, an observation the transplant surgeon made during her training.
There are a number of barriers that Black patients face when they're trying to access the transplant process. One has to do around trust of the healthcare system and of the information that they get. The other is of the healthcare providers knowing the cultural background, the social background of the patients that they're treating and being able to adapt to cater to their needs.
And that's how ATAP, African American Transplant Access Program, came to be. Since Dr. Simpson started the initiative at Northwestern Medicine, 15 patients have received donor organs.
I mean, even if it were just one, you know, it's something. It means something. It means the world to that person.
You won't find a dialysis center on this stretch of Main Street in Rochelle, Illinois. It's a 45-minute drive to the closest facility. But Mecca Muhammad calls the rural community home. And if she wants a new kidney, she has to show up for dialysis 3 days a week.
And so I'm just working with what I got, you know, the car that I have.
It took Mecca 7 months to save up for the vehicle that now transports her to appointments. It was a risky move. All that time without dialysis took a toll.
By the end of that 7 months, I was so toxic, like everywhere, like I was swollen, toxic, bumps everywhere, itching. But I made it to get the car and got back to dialysis.
It hasn't been easy for the 45-year-old who was diagnosed with kidney failure while pregnant with her daughter in 2002.
This was me when I left the hospital after my kidneys failed, after I delivered her. The fluid was so much on me that if I was sitting in a recliner with my feet up, the fluid would go up here. And then my feet would feel good, but then I would be packed with fluid up here.
You have a young woman who's in her 40s, who is the sole provider for her 2 dependent children. And you're telling this woman that she's not a candidate because she's missed dialysis appointments when, you know, when you look under the surface, the reason why she's missed those appointments is because she's attending a parent-teacher conference or she's taking her sick child to the doctor. And if you think, if this woman were to have gotten transplanted, how her life would change, how she would be able to better provide for her children and for herself. It is devastating to think that that patient would be considered not a candidate somewhere.
For 14 years now, she maintained a regular dialysis schedule, and with Dr. Simpson's help, finally had other tests to make sure she's healthy enough for transplant. Now, Mecca's just waiting for the call from the hospital.
Got my bag packed, ready. I'm so tired, I can't even describe. Just hoping this is the end of the road.
The long road to transplant is behind Ramaya Johnson.
Ready? 1, 2, 3, small pinch.
Dialysis has been replaced with multiple weekly blood draws to make sure the new kidney she received in April is doing its job. It was a 6-year wait for Ramaya, a period that included her high school years.
I really was the only one in my entire school that was sick, and it was embarrassing. Oh, man. But once I joined, dialysis, it was like a whole nother community, and you wasn't alone. You felt so much hope.
The 23-year-old found Dr. Simpson after she was dropped by another transplant team in Chicago.
It was the most devastating day of my life because at that moment I knew that we were going to be in limbo. I was dealing with panic disorder, and I was temporarily taken off of the transplant list because of my mental state. The main thing with Ramaya is she was afraid she was going to die. So how as a normal person, how would that make you feel? Oh, if I go to sleep, I might not wake up. Yeah, I'll be panicking too. That doesn't mean I'm mental. That doesn't mean I have a problem. That means I'm afraid.
Desperate to find another doctor to help her daughter, Rihanna Johnson called Northwestern.
We just kept telling our story, you know, and I'm like, we don't have nowhere to go. My baby ain't did nothing wrong. She take her medicine every day. She's in dialysis 3 days a week. Sometimes her heart will infiltrate and the blood will just squeeze out her arm every day. She can't breathe, she can't sleep.
Once the donor organ was transplanted, an immediate change.
My skin color was different, my gums started turning pink. A lot of things, little slight changes that I noticed in the first few hours and first 2 days. I can't even express how happy I am. I feel like everybody deserves a chance to experience a transplant.
Dr. Simpson is encouraged by the early success of the program. The number of African-American patients getting listed is up 18%. We have more information about ATAP on our website. Back to you.